Okay, our next plenary is very actually related to the one we've talked about the whole issue of food, and it is the plenary on global health. And we're delighted to welcome back three people who you now know very well and love, Fatima Bhutto, Her Royal Highness Crown Princess Meta Marit, and James Chow. So if you'd like to join us on the stage, please. Thank you.
Didn't get a kiss?
Well, if you want one. And now we're going to call up to the stage our convening ambassador, Karl Molina. Karl? Go, Karl.
All right, councillors, good afternoon. To all our delegates here, good afternoon. At the inaugural One Young World Summit in London, we, the ambassadors, have voted in favor of the Global Health Resolution, which states that all humans have the right to health care and nutrition, therefore calling upon businesses, governments, and civil society to work together effectively to prioritize spreading information about and providing access to good health care and nutrition. The ambassadors took on projects that support the Millennium Development Goals for health, specifically reducing child mortality, improving maternal health, and combating HIV and AIDS and other diseases. I am very pleased to report that One Young World has impacted over 1 million people through 9 global health projects, and the number continues to grow every day. I'd like to share with you some of these projects that we've had for over the past year. Lauren Bush from the United States founded the Feeds Projects to feed hungry children in schools all over the world. They have provided over 63 million school meals by selling feed bags. I have initiated the Community Preschool Feeding Project in the Philippines, which provides daily meals to a class of kindergarten students under the age of 5 who suffer from chronic malnutrition. Sunita Basnet in Nepal organized a women's health clinic which has provided HIV and AIDS counseling and testing to over 100 people and has indirectly impacted 3,600 people. The Sustainable Aid to AIDS Conference was organized by Kio Morakot Mom in Cambodia and delivered important information about HIV prevention to 300 participants. Using modern technology, Kashfiya Rahman provided women and children in rural villages access to medical consultations through telemedicine. The Gifty initiative gave 100 people the opportunity to consult medical specialists in remote communities in Bangladesh. Tiwanj Kanyenda of Malawi, together with the Jacaranda Foundation, provided quality free education, daily meals, and sanitation education to orphans. In May 2010, these efforts have been recognized by President Barack Obama. By the end of 2011, the foundation will build toilets with running water, hire a full-time nurse, and significantly improve the health of HIV-positive students. Jet Vargas from Venezuela volunteered for Un Techo para Mi País, which constructs transitional houses, implements social inclusion programs, and develops sustainable communities. The project has mobilized 400,000 volunteers and has built 78,000 houses. These projects have overcome many challenges. The conservative culture in Nepal prohibits women from talking about condoms as a means of protection against HIV. Sunita creatively thought of using street drama as a way of delivering the message of safe sexual practices. Kashfiya's telemedicine project encountered problems with bandwidth and very slow internet speed. The team thought of using a software that requires low bandwidth to deliver medical services. Instead of being stopped by lack of funding, we, the ambassadors, have looked into the opportunity of not only doing fundraising for our own projects, but also seeking the support of organizations, local government units, and companies. Now I have the great pleasure of introducing 2 of our amazing returning ambassadors, Gifty Pearl Alimo from Ghana and Omar Abdullahi from Somalia, to talk about their wonderful global health projects.
Thank you, Karl. Participating in One Young World last year changed my life. I was inspired, I was motivated, and I was challenged to take concrete action in my community, in effect, to walk my talk as a young person. This experience gave birth to Train Coach Mentor Girls Project, which myself and Senator Basnat in Nepal are currently working on. May I see by hands how many of us here know or have seen a blind girl, a girl from a low-income family, or a girl living in a rural community? Thank you. Seeing it, that means you are not alone. Train Coach Mentor Girls Project is dedicated to training, coaching, and mentoring young girls and women from low-income families, visually impaired, and those from deprived communities. The project is in two phases. The first phase of the project is dedicated to training these girls in leadership, social change initiatives in their communities. These girls and young women are then paired with mentors across the globe. The project was first of all designed to help these girls and young women to be self-confident, to inspire them to aspire, and to challenge them to take concrete steps in their communities, to bring change first of all to their lives, their families, their communities, and their countries. What results have this project achieved so far? I am happy to say that, so far, 289 girls and young women in 4 countries, Ghana, Zambia, Nepal, and Kenya, are currently participating and benefiting from this project. Just before this summit, we organized a forum where a blind female lawyer, a blind journalist, met with 300 visually impaired girls at the School of Ekropon in Ghana to share their life stories with these girls, to tell them that you can make it despite the fact that you are visually impaired. We are currently engaging 9 young people in 5 different countries to implement this project in their communities. What have the girls to say about this project? And I quote from 2 of them. Deborah is 19 years old and she's blind. She's attending the school at School of Ekropon in Ghana. And she says this: when I became blind, I thought the world had come to an end. But from what I've learned today, I can still make it with determination. Another girl, she's 16 years old, Elizabeth Addy. She says, I have been inspired to be the best and challenged to think and act differently wherever I find myself. If we are to champion global health, these girls and young women need to be engaged actively. I would like to end by saying that we should not only come to One Young World and go back home. We should not only clap or raise our hands or even give standing ovation to brilliant presentations, but I charge you all as ambassadors to go back to your communities, take concrete actions, start small, in your family, in your schools, in your clubs. Do something to change and to make an impact in your communities. Thank you for your attention.
Fatima carried her daughter on her back, walking 300 miles to the largest refugee camp in the world. Upon her arrival, she realized her daughter was no longer with her, that she was dead. Do you know how that feels? You don't, because you have never experienced it. No mother should ever go through such pain and agony. The United Nations declared a famine in South Somalia on June 20th of this year. More than 12 million people are affected in the Horn of Africa. It's really unfortunate in the 21st century, with all our advancement scientifically and technologically, that we cannot prevent such catastrophe. As a result of the current crisis in the Horn of Africa, I and my close network of youth leaders across Canada decided to do something about it. As a result of our discussion, we stimulated a global movement using social media amongst Somali youth to bring awareness and humanitarian aid in Somalia and the Horn of Africa. We created a portal, if I can have the slide. We created a website, a platform, and now we have 11 chapters across Canada, the United States, and Africa. We achieved thus far fundraising across Canada and the United States, Africa, and the Middle East, and we managed to raise over $4 million. In honor of the countless Somalis walking for miles to refugee camps, 7 Somali Canadian cousins walked for 4 days from Calgary to Edmonton for 300 miles, mimicking the average distance a regular Somali person would walk to the refugee camp. They raised $64,000 and inspired similar projects of further 11 cities across Canada and the US. These are some of the fundraising events that took place. And that's when they walked from Calgary to Edmonton. Droughts will happen. They always will. But they don't have to be a disaster. They can be managed if we pay attention to the early warning systems and act. As Desmond Tutu says, we are one big family. We must plan for the future together because we are living in a globalized world. I would like to take the time to thank the people of Gaza in Palestine who, despite their limited resources, raised $18,000 for Somalia. Finally, I would like to thank all those who have responded to the famine in Somalia, in the Horn of Africa, but more work is needed. Thank you.
Thank you, Gifty and Omar, for your very moving presentation. You know, our thoughts are with the people of Somalia. Now we move on to the resolution. We here at One Young World fundamentally believe that there is an urgent need to combat HIV and AIDS, malaria, and other diseases, as they remain to be significant threats to the progression of our world's people. Therefore, we urge the 2011 summit to adopt this resolution. In the belief that we urgently need to combat HIV and AIDS, malaria, and infant mortality, One Young World resolves to withdraw their support for governments until they demonstrate their firm commitment to the Millennium Development Goals for health. And we call upon One Young World delegates to withdraw support from governments or political parties and using their networks and social media networks to publicize this withdrawal until such time as they prove their commitment to the Millennium Development Goals for health. Thank you.
Ambassadors for this session to come onto the stage, please. Give them a round of applause. Terrific. Councillors?
Hi, everyone. It's a pleasure to introduce to you today to kick off the Global Health Plenary Yuan, who has joined us today from China, where she studied clinical medicine at Peking. I'm not done, hold on. Where she studied clinical medicine at Peking University, undertaking research into the field of liver and prostate cancer. Along with this, Yuan is deeply passionate about the field of preventative medicine and about the simple, easily accessible solutions that can save millions and millions of lives. In addition to her advocacy in this field, she's also donated her time and her medical knowledge to orphanages, where orphans suffer from physical disabilities, and to hospice care facilities. So please give her a round of applause.
Good afternoon, everyone. I am gonna start my speech with two stories. First of all, when I was an intern at a hospital, one day, an ambulance rushed in and this man, 40-year-old, was taken in. Together with him were his wife and his son, a 10-year-old boy. A heart attack. His wife and son knelt on the ground, just begging us to save him. We did what we could do, but he was gone. That was my first time witnessing a human death. And the second patient I remember vividly till now is a 24-year-old musician. He came from a deprived area of Western China to Beijing 4 years ago. He worked really hard and finally earned his own apartment and met his love and was just about to get married when he was diagnosed with stomach cancer, stage 4. I don't like telling those kind of stories. I don't like it at all, but this didn't have to happen. We could have stopped them, but how? Prevention. Let me just give you some statistics about what prevention can do. In 2009, diarrhea has taken away 2.6 million lives, and over half of them were children. They didn't have to die. We could have saved them, but how? Prevention again. Just a piece of soap and a standard way of washing hands can save those lives. Those of you who know a standard way of washing hands, please raise your hand. I'm so glad to see there are so many raised hands. Thank you. But for those who didn't know this standard way of washing hands, may be wondering now, what is this secret standard way of washing hands? So now let's practice washing hands together and see what it is. First of all, show me your hands. Thank you. And roll up your leaves, please. Relax, it's not for a fight. And now just assume that our hands are all wet and applied with soap, right? And now let's rub our hands together. First the palm, and then back, and then fingers. Left fingers, right fingers, and then nails. How to wash nails? Like this. Yeah. Yeah. Wash your nails like this. And then do that for 20 seconds. After that, we are done. And dry our hands, of course, with clean towel, and we are ready for dessert. Now. But please, just let me finish first. Now, let's see how many of us do wash our hands in the standard way for 20 seconds every time. Those of you who do that, please raise your hands proudly. Wow. Now I definitely see much less hands now than before. So those of you who don't do that, including me, unfortunately, let us So let us just start that right now, today, and please influence those people around you. Teach them how to rightly wash their hands. And because why? Because just simply that, simply a way of washing hands can save over millions of lives in 2009, which we failed to do. And now that we know prevention is really important and can be done in a simple way, what can we do to complete this? In my opinion, there are two levels, two things to do on different levels. First of all, individual level, that is the possible patient level, of course. That is us. Just as mentioned, it doesn't have to be big. What we can do in our daily life is very simple. Just quit smoking, drink less. I don't want to just quit drink, you know. Just drink less. And there's more. Pay attention to what we eat every day, and of course, have a regular health check. Second of all, top-down level, which is much more complicated, which is where the medical knowledge and medical source is from. First of all, medical workers and what? Companies, media, and so on, including all those topics we are talking about these days. What can they do? Medical workers, they can provide us with medical knowledge and source. And media, they can help us spread the medical knowledge. And companies, of course, they produce medical materials and equipments. None of them can be divided from each other. They are deeply related. But we cannot simply ask a medical company to cost his profit for what? For non-profit organization. But we have to find a compromising and a more enduring way to do this. For example, we can introduce more cost-effective medical solutions like medical equipment at a lower cost, but with equivalent quality to those less developed regions, so that people, they can get basic access to those medical services. And at the same time, our company can enlarge his profit by what? By enlarging the region of his customers. So this will be the ending of my speech. And finally, let us remember that we are the hope of our next generation. We are the hope of our children and children's children. So let us please work together and act and make it a better world. Thank you.
That was amazing. Thank you so much for teaching us all how to wash our hands. It's my great pleasure to introduce to you Gizem Görünmez from Turkey. She is studying to become a doctor. She studies very, very hard. But she also loves her voluntary work. And she has her own TV program on a local TV channel in Turkey where she focuses on issues of global health, together with professionals. Gizem strongly believes that mass media can make a great difference in informing people around the world of how diseases can be prevented. She's at the same time engaged in securing the quality health level of health information. Today, she says anybody can get attention in media for giving health advice that are not necessarily correct and in line with the health authorities. This, Gizem intends to do something about. She is a member of the Youth Advisory Panel for the UNFPA, and she's also involved with the campaign 7 Billion Actions. Welcome on stage.
Good evening. As a future doctor, I can say that your future health is a reflection of how you live today. The Global Health Agenda is a list of health issues which are mostly about preventable diseases. To prevent from many diseases like HIV, AIDS, tuberculosis, hepatitis, and cancer, it's very important to be informed about them. Countries all over the world can and do create awareness of health through the use of media, which is the most effective way to influence members of a society on a large scale. In some countries, TV programs about health inform people to visit a doctor or be vaccinated or how to avoid infectious diseases. For example, in Ethiopia, where almost half of the children who don't go to school watch the TV program called Segay is Learning by UNESCO. It's a cartoon about basic hygiene, so they can protect themselves from many infectious diseases. With the help of mass media, governments can make people pay attention to health by broadcasting TV programs, commercials, or public service announcements. Moreover, I have found an opportunity to create awareness about health on TV in Turkey. During this year, I have hosted a TV program every Wednesday on a local TV channel in Izmir, the city where I live. In my TV program, I and my guest, who is a professor on health, talk about diseases, explain how diseases occur and how we can prevent them. I do this voluntarily under hard circumstances without being paid whilst completing my medical studies. Also, I'm the member of Youth Advisory Panel at United Nations Population Fund, where I take an active role in the 7 Billion Actions, which is a global movement for all humanity. While the fact is clear that at the end of 2011, the global population will reach 7 billion, I want all you to get involved in this project too. Also, in addition, I'm the member of First Aid for Everyone Association, where I can tell people how to do first aid in an emergency situation in both meetings at high school for students and some of my TV programs with a professional. Nevertheless, one of the major issues that have to be emphasized here is the accuracy and the mode of presentation of health information. Although TV may provide useful information to individuals about disease prevention, treatment, and control, it's hard to be sure about the accuracy, the reliability, the quality of TV-based information. Furthermore, all over the world, many TV channels have TV programs and PCA about health, but most of them aren't checked by the health authorities like the Health Ministry or other health organizations. And even more so for the internet. What I want is for governments to make all health information channels made and controlled by the health authorities, and I want to call you to action. I want you not to believe the content that's not from a trusted source of medical information on TV or on the internet. If you see misleading, non-medical information, which potentially results in death or sickness, warn people about it. Tell people to be more aware so we can battle this together. The use of mass media and the internet as a health information channel is essential. But I believe standardized TV and internet products will effectively inform people and prevent undesirable consequences. Don't be afraid of being informed about your health, afraid of being misled. Thank you.
I've noticed that these days we use the word crisis a lot, whether it be financial crisis, humanitarian crisis, economic crisis. But our next speaker, Thais, who comes from Brazil, knows what a crisis really is. She lives in a city where crisis happens every day, where a woman and a child, or even a man and a boy, don't know that someone's going to come to their home in the middle of the night, where they'll be able to see the sun rise the next morning, where they're going to have enough money to buy enough bread and water, let alone a substantial meal that is enough for us to eat. It was also one of the most violent and vulnerable and poorest in Brazil. But she hasn't just, accepted the situation, of course not. She's a strong individual, and she represents Brazil in the G20 summit. G20 not meaning that G20, meaning an even more effective one called Girls 20 Summit. She does that. She represents gender issues, law and justice. She holds a flame that rejects human rights. She does everything, and also she can speak 5 languages: English, Portuguese, French, Spanish, German, but I record not Chinese yet. We'll get you onto that. And also our Chinese will help you to wash your hands. And she does this also by amplifying her voice. She's a citizen journalist by contributing to websites as well. It reminded me when I read your profile on that piece of paper what a citizen journalist is. Forget the journalist, start with citizen. And that also reminds me of what my new friend Fatima said to me yesterday when you were talking so beautifully but so honestly about Pakistan, is that it should be the duty, it should be your desire to be a good citizen of your country. So everybody welcome Thais.
Hello, can everyone see me, listen to me? Okay, good. Good afternoon, everyone. Thank you very much for the welcome. And to address the serious issue of global health, I will start by talking about a tragic case that happened in my country in 2002. Aline Silva Pimentel was a 20-year-old Afro-Brazilian woman who lived in Rio de Janeiro. In her 6th month of pregnancy, she passed away. She died because both a state clinic and a hospital denied her timely care. It was later concluded that her life could have been saved if she had had access to basic medical attention. Aline's case, unfortunately, is not unusual. In Brazil, approximately 98% of maternal deaths occur due to avoidable causes. I chose to mention this case because last month, the United Nations Committee on the Elimination of Discrimination Against Women condemned Brazil for Aline's death, making it the first case of maternal death to be pursued under international law in history. This case demonstrates that achieving global health is much more than a medical challenge. It is first and foremost a socioeconomic one. Science is continually advancing, allowing medicine to save more and more lives. However, these benefits are not available to society as a whole. Therefore, in order to achieve global health, it is really important that we also seek social justice and equality in its various forms. Gender inequality is one of the biggest issues to achieve global health. The World Health Organization labeled it unequal, unfair, ineffective, and inefficient. Every day, 1,500 women die from childbirth or pregnancy-related complications. 99% of these deaths occur in developing countries, showing how socioeconomic inequality can impact global health. That's why gender equality and maternal health are 2 among the 8 Millennium Development Goals. The international community agreed to reduce maternal deaths by 3/4 by the year 2015. However, by 2005, the death rate were only reduced by 5%. Therefore, we definitely need to hurry up. Gender inequality in health is not only a result of biological conditions. It is first and foremost a result of traditional gender roles. That is, how girls and boys are educated, how their behavior is supported by norms about masculinity and femininity, and also how power relations are established between men and women. Social norms prescribe double standards for men and women regarding sexual health awareness, sexual behavior, sometimes even legitimating sexual violence against women. This means that if the problem is built into social norms, it can also be changed through social change. Brazil, as well as many other countries in the world, has the international and constitutional duty to provide health care for its citizens. Therefore, the project I intend to undertake after this summit is to conduct a research on avoidable maternal deaths that occur in Brazil. We aim to identify who is responsible for these deaths. If it is the government, if it is the doctors, who is responsible? And in the case where governments are responsible, we want to investigate what kind of legal measures are available to address this problem. If we want to identify if the politicians are punished or not, and how. Well, I invite you all to take part in the subject, in the research, because the research results will allow us to fight for solutions for this problem by advocacy and policy suggestions. Aline was a part of a more vulnerable social group in Brazil, but we all have to highlight the existing disparities in our nations so that we can fix them and promote a more just and equal world where people's lives and health is respected regardless of gender, race, or any other socioeconomic differences. Thank you. Thank you.
Okay, next we have an envious resume, so get ready for this one. Brendan comes to us today from the United States, where he is a committed supporter and an advocate of bringing global entrepreneurs, such as yourself, and information technology into healthcare in order to improve healthcare outcomes, whether that's in the field of eliminating chronic illnesses, such as HIV/AIDS and malaria, or in aiding clinical researchers and pharmaceutical distributors. Brendan is also the president of Art with Meaning, a nonprofit group that funds, organizes, and implements art projects that raise awareness into social injustices. This year, they are focusing on the cause of women's rights. Brendan, and by the way, Brendan's resume is so impressive we had to edit it down. But Brendan is also a managing director of a healthcare IT consultancy called Falcon Consulting Group. So please give him a warm welcome.
First off, I just want to say how impressed I am with all of you. David mentioned that there are only 3 rock stars here this weekend, but really you are all the rock stars. So put your hands together for yourselves. I'm going to tell you a little bit about myself, then my passion, and finally, what we can all do to improve global health. I'm the managing partner of Falcon Consulting Group, a healthcare informatics consulting company which implements electronic medical record systems. These software systems are used by healthcare workers to collect, aggregate, and use medical data for diagnosis and research. My company, Falcon, reduces inefficiencies in the use of EMR systems to create a positive impact on health outcomes. If we can introduce health informatics in the developing nations, we could, through the research data collected by point-of-care providers, work towards eliminating HIV and other diseases in those countries. I hope technology can be better utilized in health systems of nations worldwide. So what is global health? Is it medicine? Is it economics? Or is it politics? It's everything. Diseases are border blind, but treatment and access to care are not. Where we are born is perhaps the prime determinant of health outcomes. 1 million people die of malaria each year, mostly children under 5 living in Africa. The effectiveness of some drugs is fading. Tuberculosis, which was almost eliminated, has reemerged with the spread of HIV. Nearly 2 million people continue to die of HIV-related infections, most of them young, married African women. In developing countries, even with the support from governments, foundations, and public-private partnerships, we lack quality, timely, and sensitive data to impact health policy decisions and help develop pharmaceuticals for those cases. Frankly, EMR usage in the developing world is essentially non-existent. Now, imagine a world where all healthcare providers around the world would be able to diagnose illnesses in the early stages, access relevant research and recommendations from their peers across the globe, and track the progress of their patients over time. Imagine a world where epidemiologists were able to identify outbreaks almost immediately, and economics had better access to tools for policymakers and investors to understand the impact of health interventions. The cure to some of our most deadly diseases, such as HIV, could be right around the corner with timely, accurate, and complete data for the prominent researchers of today. These are realistic outcomes, but things must change. The solution to the problem is not a simple one. First, EMRs need to spread from wealthy nations and deep-pocketed healthcare institutions to the developing world. There are funding gaps, language barriers, and other concerns that make adoption of EMRs in the developing world increasingly difficult. Also, the bureaucracy of some governments, an insufficient supply of healthcare workers, and internet deficiencies help make this seem like an insurmountable task. But isn't that why we're here today? I invite the One Young World to join me in promoting the concept for a revolutionary social business that will shape health outcomes for centuries to come. This project will develop a network of entrepreneurs who will work with our existing software and hardware vendors to design and create culturally sensitive, simple, lightweight software. The next phase of this project is to bring the new software solutions to healthcare providers in the developing world through creative and cost-effective distribution channels. The business will then forge new partnerships for implementation and support to ensure the long-term improvement of the health of impoverished nations. The data collected from this project will be aggregated and sent to the most prominent researchers to better understand the diseases and outbreaks that continue to kill millions. The project will create jobs in the developing world and will enable healthcare providers to make more informed decisions, which will lead to better health outcomes. I call upon all of you. We need your help to bring this concept to your communities and bring your entrepreneurial spirit to expand our concept. You can make a difference right now. Never lose your spirit. Thank you.
I know this is going to be the last time I get given the microphone at this event. Well, where is Kate anyway? She's not here? She's not? She snuck off. She's having a little tea break. But I just wanted to say thank you to Kate and David for having us here, and not just for inspiring us, but also for moving and for touching everybody who's been here in this room over the past couple of days. It's been a life-transforming experience for me, and I'm sure it goes at least as much the same for everybody else here today in Zurich. Thank you so much.
Thank you for coming. Thank you.
And thank you also for making HIV/AIDS an integral part in the draft resolution of this last plenary, or second to last plenary, but for me it's the last one, on this last day here. We're in the 30th year of HIV and AIDS, and I think the great danger that we're in is that everybody will forget that it is still here. Did you know that 7,400 people get infected every day? Did you know, as it goes to about half of this room, that if you're a woman of reproductive age, you're more likely to die of an AIDS-related illness than anything else? Those are shocking statistics, but if you embrace it and you absorb it, it could be one that you don't really need to know in the future. Me and the Crown Princess, we're both UNA's Goodwill Ambassadors, and over at UNA's, we're developing a youth strategy to help bring to life the political declaration that was signed off at the UN this summer. We don't want it to become another piece of paper. We don't want to have gone there for no reason. And we want to really make this count. So we're going to be designing a youth strategy which is inclusive and open, and it'll be online, and all of you are invited to be a part of that. Young people always say that they're not given a voice, but we have a space ready, open for you. And I know Kate and Dave won't mind if I say this really quickly, but you can tweet us at UNAIDS. If you're interested in being part of this process, it's going to be run by people and not by politicians. And that just leaves me with the easy bit to introduce an incredible person, individual, whom I just briefly met as I ran in just now. But when I was in the plane on the way to Zurich from Beijing, there was one thing that stood out about you, and you were the last biography on my file. In some ways, it was not necessarily the best for last, but the happiest for last, because your project is called Happy. And I know that your country, Brunei, is run on a gross happiness index, which we all kind of smiled about, but there's something quite beautiful about it. Happy spreads HIV awareness, including vital knowledge on teenage pregnancy and sexually transmitted infections to 4 different districts over in Brunei, Darussalam. And there was another thing I realized, apart from the word happy, which I haven't heard so much in this conference, the other 2 words I haven't heard are love and respect. Maybe I just haven't been in the right sessions, but I think that's a great couple of words for us to think about. And the last word also would have to be tolerance, because that's the word that you taught me in 2008 when I first met you. And the Crown Princess says that she thought that tolerance was a great word, and I said that I didn't like it because I can't believe I actually had the guts to say that, but I said I didn't like that word, and you said why? And I said because it feels like, you're putting up with me. And she says, where I come from, tolerance is the most beautiful word. And this summer, I understand why it's the most beautiful word in your language. So we don't just applaud your leadership, but we also stand in great solidarity with everybody there. So with that, let's have Iswandy from Brunei to come here and to talk to us.
All right. First of all, I think it's not, ours is not the gross happiness index. I think that was Bhutan, if I'm not mistaken. Correct me if I'm wrong. But ours is more on the social welfare. All right, thank you very much, James. Assalamualaikum warahmatullahi wabarakatuh, and hi to all. Congruently, of the 8 interlinking Millennium Development Goals, though I just learned there are at least 2 missing link for the Millennium Development Goals here in One Young World, 4 out of 8 has very much direct relation to health, namely end poverty and hunger, child health, maternal health, and combat HIV and AIDS. There are many health issues that has made headlines for the past few years, be it from cardiovascular diseases to H1N1. But since I am an HIV advocate and I was introduced by UNAIDS ambassadors, James Chow and also Her Royal Highness. So let's talk about HIV. UNAIDS has made a target that by 2015, and it's ambitiously called the 3 zeros. 0 new HIV infection, 0 AIDS-related deaths, and 0 discrimination. Some of us may be pessimistic or skeptical of these targets, but not more than 48 hours ago, we were reminded that we, young people, are actually preparing the world for younger people, our younger brothers, our younger sisters, our children. Now, a serious question. Let me see a raise of hands. Who here in this hall has a friend or a family member or a relative or maybe just someone that we know in our college, where we work, or in the neighborhood that we're living who is living with HIV? Please, a raise of hand. Thank you very much. As you may see, young people are growing in a world of HIV and AIDS. And again, those who are aged 14 until 25 in this room, can you please stand up? Well, I don't know if we have any 14, but for those who are aged 14 till 25, can you please stand up? All right. I have news for you. According to UNAIDS, 40% of the new HIV infection is from young people of your age range. So look, that's a lot of you guys. Thank you very much. That's a lot. Thank you. Thank you. So just to show human statistics there. The key affected population, for example, transgenders, people living with HIV, and vulnerable populations, example like street children, those who are in early marriage, or children for poor families, are often very much stigmatized and discriminated, and again, left out in our system. Many countries still rely on external donors, for example, the Global Fund, for antiretrovirals, medical care, and etc. And talking about antiretrovirals that suppresses HIV, the free trade agreement can affect affordability of antiretroviral medicine to suppress HIV. Comprehensive sexuality education that addresses sexuality, life skills, human rights, and preventive measures on HIV and AIDS are not being implemented in many countries. And then again, the old stigma and discrimination is still rampant everywhere due to lack of information and prejudices. I was there last week in South Korea, and these people who are transgenders and living with HIV has problem to enter the country for the AIDS Congress even. And just to remind a classic question, do we even know how people who are living with HIV looks like? Well, I'm going to give you a shot. Look at the person to your left and right. That is how a person who's living with HIV looks like. A person who has dreams like we. A person who has families like we. And most importantly, a person, not just some mere statistic. And the list goes on and on with all this 30 years of problem of HIV and AIDS. But let us walk the talk. What can we do as young people to mobilize our community on AIDS? You don't have to be an HIV advocate, you just need to be yourself. For example, first of all, you can create awareness just simply by talking about the perceivably taboo topic of HIV. As ignorance is not bliss when it comes to HIV. Tweet, update your Facebook status, talk to your peers, discuss with your college on how to create awareness, or even run concerts, drama, or art show just to talk about HIV and AIDS. Or for example, like how James mentioned about my Happy program, it goes to schools. You can go to schools, talk about HIV and AIDS, because we young people has an advantage when we talk to our peers. We can relate to each other. You can also show some love. Please show some love. Show that people living with HIV are not to be stigmatized or discriminated, or worse, violated. Let us also not to forget, engage, empower, and build the capacity of young people, including the affected population, which is men having sex with men, transgenders, people using drugs, and people living with HIV, to meaningfully participate and take the ownership of the HIV situation. Or if you're adventurous enough, you can demand for comprehensive sexuality education to be implemented in your national curriculum. Because knowledge is power, and young people are not provided with enough knowledge on HIV and AIDS in today's world of HIV. And there are many more wonderful things that you can do. You just need to be creative. Finally, my friends, my brothers, and my sisters of one young world, we young people are in the middle of HIV epidemic. We need new leadership for an old epidemic. As mentioned, come on, let's be realistic. 30 years, there is no cure, you must be kidding me. Let's do this. And I would like to end it all with, even though our countries have very low prevalence, but be it low or high prevalence, it should have our highest concern. Thank you.
Thank you so much. I have been working for many, many years in the AIDS response, looking for youth leadership, and I can just say I'm amazed by the speech you just did, and I'm very, very grateful for bringing this very important issue to One Young World and the delegates. So, it's my great pleasure to introduce Zamafuze Lumka Ngcobo from South Africa. She's laughing because I'm not saying her name properly. We practiced earlier, but okay, I did my best, sure. She is a postgraduate student in strategic communication in Johannesburg. Zamafuze is passionate about how to create a thoughtful and democratic communication process for critical dialogue. She underlines the importance of linking health, gender, and development issues and see them as a whole. She is also very engaged in finding new ways of representing the African narrative to the global world, which is still so often altering negative and challenging perceptions. Zamafuze is most of all passionate about aspiring for the kind of leadership that can successfully reconcile political, economic, and health concerns with human value. Some of the projects Zamafuze is involved in, she is a Mandela Rhodes Scholar. She is currently being mentored by Wagner Edstrom, and she has taken theater to primary schools to tackle sensitive issues such as sexual abuse amongst young children, and she was able to engage the South African Police Service in this. I am very, very, very happy and proud to welcome you here on stage to give you a speech.
Sanmunani, good evening. Tembega is a bright 17-year-old girl. Determined to go to university, she completes high school. With no funds for tertiary education and no income, she falls pregnant as a means of survival and contracts the HIV virus. The government will pay her 250 rands for her child and just over 1,000 rand monthly when she falls sick from AIDS. Tembega is actually relieved that she has an income every month. After a year, she falls pregnant again, another 250 rands. And for the third time, another 250 rands. Eventually, Tembega gets a job at a local firm. However, 3 years later, Tembega falls ill and can no longer work. Tembega is now 23 years old, with 3 children, sick and unemployed. Her children suffer from malnutrition. This is the story of many young women and children around Africa today. I know Tembega. In fact, I know a handful of Tembegas. We are all aware of the tragedies that happen around the world, for many of us in our own backyards. We know of the plight of malnutrition, disease, and other health issues that are plaguing our developing nations. So the question that I'd like to pose to all of you here, but specifically to my African brothers and sisters here, is what can we do? What can we do within our communities to challenge these issues? We can't look to government anymore for solutions. What we need is leadership. Corporations and influential individuals that operate and live within communities. It is the responsibility of corporations to invest in the health of communities that actually make it a success. That investment grows. Eventually, it supports whole countries. By responding to the needs of the people who have the potential to contribute to their success, businesses and economies alike can have advantaged positioning. As you've heard in the past 2 days, terms such as corporate social responsibility have become trendy. But today, we propose that a new term takes on the trend: corporate health investment. We would like to challenge corporates to start working proactively on health issues. By investing in the health of your surrounding communities, the amount of economically active people will increase. Business will strive, and we can engender a generation of economic independence rather than of welfare and dependency. You see, giving people the ability to earn a living gives them something to believe in, a future to look to. It even changes the way they make decisions. As a result, the overarching narrative for Africa and other developing nations can actually be changed. We also commend those few corporations that have actually seen health investment as a long-term opportunity. In Africa, we have organizations such as Anglo-American, Eskom, De Beers, and BHP Billiton. These are just some of the companies that now provide their employees, their spouses, and their children with free antiretroviral treatment, and also with community healthcare services. Within a year of Anglo-America's rollout treatment, sick leave fell by 69% and absenteeism by 53%. So before offering actions for this resolution, I'd just like to know, by a show of hands, how many of you here are from corporations? It's quite a large number. Thank you. Fellow change agents and leaders, on behalf of the South African delegation, I would like to challenge those of you from large corporates to find out who in your organization could mobilize this type of action. Ask them why are they not doing it, and if they have any intentions of doing it. Perhaps also, in the coming weeks, we can compile a league table of companies that are health responsible and effectively respond to the needs in their communities. This could serve as a challenge to other corporations. If we can identify communities with a health crisis in our countries and an organization that operates within that community, let us challenge that organization to help invest in the health of the people that actually make it a success. As concerned world citizens, let us influence those with sufficient resources within our communities and make corporate health investment a trend and an obligation that organizations will feel compelled to adopt. Thank you very much for listening. Ngiyabonga.
So before we actually read the resolution, there's one very important comment that we'd like to hear from Anna in Bulgaria.
Hello, everybody. Thank you very much for that opportunity.
Do you want to come up here?
Yeah, I might as well do. Should I turn it off, or?
I'm sure that will work.
It's really hard to start, and you'll get why in a second. I probably suppose that you don't know that there is something that kills a person every 30 seconds and 1 million over a year, and more than double are injured by it severely. Something that can be prevented just by the things we already mentioned: love, humanity, respect, attention. You maybe realize it only when it hits you. I lost my best friend today to suicide. We have mentioned all kinds of reasons that kill people today globally, but we have never talked about mental health. Thank you very much for getting up. I hope Victoria hears your applause by any chance. I don't know what there is about Scott or someone else who is doing everything. I hope she understands me for sharing that with all of you now. I would like you to participate in a very sad survey now. Could you please raise your hand if you have been touched by this suicide in any way? I mean, your friends, this is horrible. Because think about it, in any way you were close to a person whose life you could have saved just with a nice word, a nice talk. So everyone tells me today to be stronger, and I will leave this stage stronger only if I know that from now on, everyone who leaves this hall will feel confident enough to say the word suicide, to talk openly to their friends, parents, colleagues at work, to ask someone when they feel depressed, whether they're thinking of suicide, to come up with a safe plan, to be engaged with their life. Because it's wonderful that we are all so active on hotspots around the world, but there are hotspots near us. So protect those lives, protect the people who love those people, give a chance to those lives to be leaders like we are. And just thank you very much. One more thing I wanted to add, maybe to the resolution that we are offered now to vote on, is that maybe sometimes social stigma and religion around the world prevents people to talk about suicide. And many of those deaths are just not in the statistics simply because people are ashamed to say that they lost their relatives to that. So I would suggest we add that to the resolution in one way or another, and from now on carry that message that suicide is not a shame, that's not a choice, that's not someone who makes a stupid decision in their life. It's our choice not to see that someone is depressed, that someone is in need of help and a friend. Thank you.
Okay, now people, very solemn moment. I'm going to ask the councillors to stay here. Karl is going to read the resolution. We are going straight to the resolution, okay? Bear with us and think of Anna.
We urge the 2011 summit to adopt this resolution. In the belief that we urgently need to combat HIV and AIDS, malaria, and infant mortality, One Young World resolves to withdraw support for governments until they demonstrate their commitment to Millennium Development Goals for health. We call upon One Young World delegates to withdraw support from governments or political parties and using their networks and social media networks to publicize this withdrawal until such time as they prove their commitment to the Millennium Development Goals for health.
Okay, so I think you know the format. If you can call up whether you agree 1, disagree 2, or abstain 3. If we could vote now, please. Okay, so we're going to go straight through to the final plenary without a break. The reason for this is twofold. Is one, to enable our councillors who've been so incredibly generous with their time to meet their commitments. The second reason is due to the union rules and all that kind of stuff, if we don't give you food by 9 o'clock, you don't get food. I had actually checked with my hotel if I could do a room service club sandwich for 1,300 people, but it wasn't actually possible. So we're going to keep to the initial plan and actually have dinner here. So if we could thank the councillors who are leaving the stage and the delegates and those who are staying on, please do.